Another consequence of the Canadian healthcare system: reduced medical school sizes. After all, if you don't want a lot of doctors around, what better way than to stop them from actually getting into medical school? Good idea. So, less doctors graduating. Outcome of that, though, is a doctor shortage. Wow, what a surprise. So you can't get to see doctors. As a former Canadian physician, they beg me now to come back to Canada. They will pay me extra over Canadian physicians to come back because nobody wants to practice in my province of Ontario. I can make more than my colleagues just having left, so I can go back. The other consequence of that is that who ends up going to medical school? Well, people who are less interested. The less qualified candidates. After all, if you're really qualified and you're really smart, and I will tell you now, not to brag about me in particular, but the smartest people in society, the best trained, the most critical thinkers in society are doctors. Nobody has had more education in society than doctors, especially specialists. Okay? By the time you're finished school, most doctors are in their 30s. And they have been to school for 25 of those years. It's a long process. They're extremely highly skilled individuals. However, if you're that skilled, why would you bother if you can be something else, like a lawyer, or an engineer, or a politician? Anything could be better. Many things are. And so the best and the brightest don't go to medical school anymore. That has led to another consequence: increased numbers of foreign medical graduates who do the job the Canadians no longer want. Unfortunately, foreign medical graduates graduate with lower medical standards and have this constant focus on medical social justice. They help promote the system, and they don't know anything different. So they work to do what's good for society, so the patient becomes even less relevant. What does that lead to in the end? Part-time doctors. The number of part-time doctors in Canada is burgeoning. Why work full-time if you're going to end up taking the year off anyway? Doctors have 2 careers, particularly women doctors. It's nice. The women's lib movement has been very powerful in Canada. Lots of women doctors. They work part-time. You know, put in 20 hours a week, shut your door, you're not responsible for anybody, doesn't matter. It's not the kind of commitment that you expect out of doctors who make this a career. It's just a job. And then other doctors will do it part-time and have another career to do something else, run a business or do something else. We talked about doctors. What about nurses? Same problem. Huge nursing shortage. Who wants to be a nurse if you can't be guaranteed work? If you're busy shutting off hospital wards and you don't know if the emergency room is going to be open or closed, you don't know if the delivery room is going to be open or closed, you don't know if you're going to be working. So there's a nursing shortage in Canada as well. All of this is because of the rationing that occurs with limited access to doctors, specialists, treatments, hospital beds, and technology. The consequence of which is prolonged waiting times, progression of illness, progression of impairment, progression of disability, and increased costs to the healthcare and welfare system. The Canadian healthcare system is not a healthcare utopia, but rather a social, non-free market dystopia that fails in its fundamental underpinnings and punishes those stuck in the system who are not politically connected or wealthy enough to seek healthcare outside of Canada.